Bratzler when this is live. All right, go ahead.
So good afternoon. I'm Dr. Dale Bratzler. I'm the University Chief COVID Officer and the Enterprise Chief Quality Officer here at OU Health. I will be sending out a handout of some of the data for Oklahoma. I know most of you keep track of the data on your own at this point. One of the first things I've been highlighting is that we're still seeing substantial community spread of COVID-19 in Oklahoma. Oklahoma currently ranks third in the nation with respect to the number of new cases per capita in the country, following only Arizona and California. So I think that's very important that everybody knows that despite the fact that we're starting to roll out vaccine, we need to continue to not let our guard down because the virus is still spreading rapidly in Oklahoma. As of today, there were 3,500 new cases reported today, 43 additional deaths. Sadly, in the past week, we actually had 27,000 new cases in Oklahoma in the past 1 week period and 222 deaths that were reported in the past week. Our current 7-day rolling average is just under 4,000 new cases per day on average, which is slightly down. We peaked this past week at around 4,200 new cases per day. So again, I just want to highlight that there's still substantial community spread of COVID-19 in Oklahoma. I know I get a lot of questions about is the variant strain that's more contagious in Oklahoma, and though it hasn't been confirmed yet, I think it's very likely because we know it's in Colorado, it's in Texas, it's very likely in Oklahoma also. When you look at community spread of the virus, again, some of our rural counties are seeing the greatest population incidence of COVID-19 right now. So Carter County currently has the highest rate of population incidence of COVID-19 in the state. And just to highlight, since the start of the pandemic back in March, they've only had 4,200 cases confirmed of COVID-19, but 1,000 of those have been in the last week. So that's one of the patterns that we've been seeing in many rural counties is outbreaks that are happening that are driving their population incidence quite high. There are a couple of pieces of good news this week. One is the percent of tests that are run that are actually positive. So I just look at the number of specimens tested in the state each day and the percent of those specimens that test positive. And that number is down. It's around 14% this week so far. Again, we have at least one more day's worth of data that will come in. But it is down. It had been as high as 19% 2 weeks ago. It was 18.5% last week. So that would potentially be a good sign that if we start to see the percent of tests that are positive come down, that would be a good sign. And then, of course, many have noted that hospitalizations are down a bit in the state. As of yesterday, we had 1,847 people in the hospital. That's down from our peak. That was more than 100 more people in the hospital about a week ago. We peaked about a week ago in terms of the total number of hospitalizations in the state. Sadly, of that group of people in the hospital, 470 or 25% are in the intensive care unit. And again, we just simply know from multiple studies and our own watching data in Oklahoma that people that are that sick, people that have COVID have to be hospitalized, have to be placed in an intensive care unit bed, sadly have fairly high mortality rates. So we'll see more deaths in our state. I'm going to end by just highlighting an interesting article I read in the Infectious Disease News a couple of days ago that was talking about what are our chances in this country of getting to herd immunity. Right now in the United States, we're seeing almost 250,000 new cases of COVID-19 every single day. One day last week, we hit 4,000 deaths, which is something like 167 people dying every single hour from COVID-19. So the disease is spreading very rapidly at this point. And remember that there are two different ways that you get to herd immunity. One way is by infection, natural immunity that occurs after you've recovered from the infection. And the reason we don't want to get to herd immunity that way is because we know that a certain proportion of the people who get this infection will have severe complications, will end up in a hospital, and can die of the disease. But the other way is vaccination. So the fact that some proportion of the U.S. population and the Oklahoma population have already been exposed to COVID-19 and likely have some degree of immunity. We're not sure how long it will last, but they probably have some degree of immunity. And the fact that we're rolling out vaccination as fast as we possibly can, I think there is some hope that we may start to see some reduction in the number of cases as the virus finds it harder and harder to transmit from one person to another if those people have either developed their own natural immunity or have been vaccinated. Now, we know in our state that certain populations have been at particularly high risk. So certainly our American Indian friends have had high rates and disproportionately been infected by this disease in Oklahoma, and Latino Hispanic population in Oklahoma also have been disproportionately affected. So it's going to be very important as we move our vaccination efforts forward to make sure that we're getting the vaccination out into the community, into the arms of the people who are most at risk of the complications of this particular disease.
So this week we're doing the part of phase 2 that is vaccinating 65 plus, and I think you had said before that that population really only represents about 15% positives, but it's 53% of our deaths or something like that?
So I think, so the question is about the 65 and older population that's now being vaccinated as part of phase 2 of the State Health Department's distribution plan for vaccine. It's an incredibly important population of patients to get vaccinated because in Oklahoma, people who are 65 years of age and over account for 73% of all of the hospitalizations, and they account for 80% of the deaths that occur from this particular disease. So although I know there are many, many people who want to get the vaccine, want to be in line earlier, we need to remember that if we're going to slow hospitalizations and death, if we're going to really impact the people who are most at risk of this disease, we need to get the vaccine into the arms of people that are 65 years of age and over.
So Fox 24 in Tulsa wanted you to comment on, and you've said, you addressed this a little bit, but maybe just specific to this, that 15 days into 2021, it's reported January is the second deadliest month because of COVID for Oklahoma. Can we get a comment about that?
Well, so the question is about deaths from COVID-19. So this past week, we hit well more than 1,900 people in the hospital, with 25% of those people that were in the intensive care unit. And I've highlighted many, many times before, when you look at the people that are hospitalized, they're typically older, obviously much sicker, and those people that are sick enough to be in the hospital, particularly in the ICU, have a substantially higher mortality rate. So mortality is highly correlated with the number of cases that you're seeing in your state. When the case count goes up, more people get hospitalized. Some proportion of those people will be sick enough to be in the intensive care unit, and sadly, some proportion of those people will die. So it's one of the points I've made now for several, actually probably a couple of months now, that when you have a lot of people in the ICU with COVID-19, we're going to continue to see deaths from the disease in our state. That's just a sad reality. So again, the most effective way to reduce the death rate is to reduce the total number of cases in our state through the mitigation strategies that we've put into place, including masks, physical distancing, hand hygiene, and others, and vaccination.
Maybe this is a good time just to stress this again. You've said it before, but getting your vaccine is not just like a free pass that you just can go out and everything's back to normal for you.
Yeah, so one of the questions that we frequently get asked is, when can we stop wearing masks? And I will just tell you, for all the healthcare workers that we've vaccinated, we still absolutely require all of them to wear a mask. Because when you look at the studies that were done to get these vaccines approved, what those studies showed was the vaccine prevents symptomatic COVID-19. In other words, if somebody is fully vaccinated, they're not as likely to get symptomatic COVID-19. In other words, 95% efficacy. Some people will still get it. 5% of the population may still get COVID-19, so that's important to remember. But the other thing that we don't know is, does the vaccine prevent asymptomatic spread of the disease? In other words, if I'm fully vaccinated and I'm exposed to somebody in my clinic with COVID-19, can I get colonized infected, not have symptoms, because the vaccine seems to be pretty effective at preventing symptoms, but may I still spread the virus to somebody else if it was in my nose, colonizing me? So we're telling everybody, just because you're vaccinated, we don't yet get to stop the other mitigation strategies.
You were talking about the hospitalizations, and they have dropped just a bit, about 150 from the week before, I think. But what, Dylan at KLC, I was just asking, what specifically, do you have any idea what's behind that drop? Is it, and how much strain are hospitals still under?
Yeah, so I don't know exactly why we've seen some of the hospitalizations drop. I know that there had been some reduction in some of the reporting. In other words, the completeness of reporting wasn't absolute. We dropped down as low as 90% of the hospital systems getting their data in to the health department, at least at one point this week. But I don't know otherwise. We know that some of the big peak in cases that we've seen over the past week was tied to some delayed reporting. In other words, the tests had been done several weeks before, but were just reported by the state health department. So perhaps some of the peak that we saw were cases that occurred a couple of weeks ago, perhaps. And so maybe we're starting to see fewer cases. But we still have a lot of people in the hospital, still a lot of people in the ICUs. I know in our system, our ICU capacity is still quite constrained at this point because of the number of people that are in it. I looked at national data that was reporting on Oklahoma ICU availability and said that we only had across the entire state about 14% availability of ICU beds in the state. So the hospitals are still quite stretched. I have to tell you, the one thing that's really become clear is that some of the healthcare workers that work in these units, like the COVID units, the intensive care units, they're really getting tired. They've been working for a long time, for months now, with little time off, taking care of a really sick cohort of patients.
This one just came in as a good question. Please address the low flu numbers and rumors that doctors are conflating flu and COVID infections.
Yeah, so this is not unique to Oklahoma. It's happening across the entire country. CDC reports very low rates of influenza transmission this year, this flu season, and that was seen in other countries, particularly in the southern hemisphere, who experienced their flu season this past summer during our past summer. So there are a variety of reasons that have been suggested for that. So some of my colleagues and I were talking about it yesterday. So one thing is wearing masks, physical distancing, doing hand hygiene. Those are all known to prevent transmission of influenza. In fact, if you look at much of the data that supported the use of masks for respiratory viruses, much of that was published in the past looking at spread of influenza. So the things that we're doing to prevent the spread of COVID-19 actually also prevent the spread of influenza. As one of my colleagues pointed out, there's been real reduced capacity in schools, classrooms. So some school districts have moved to 2-day weeks and then 2 days of online learning, and others that separate. So reducing the density of students in schools. There have been a number of studies over the years that have shown that when schools are closed, influenza transmission drops dramatically because kids really do get infected with influenza and can spread it to their parents and other people. So the fact that our schools aren't as dense with alternate schedules and other things may account for some of it. And then there's some suggestion that we just don't understand that whether having other respiratory viruses like COVID may prevent people in some way from getting influenza or RSV in kids. We don't know why, but both influenza and RSV infections in Oklahoma now are very low, but that's true across the nation.
Well, I know we did a really good job of encouraging people, which we always try to, but of getting the flu vaccine this year especially because to help them not have, anyway, do you think that do we know anything about the numbers of people that received the vaccine?
Yeah, it's a great question. So how many people took the flu shot this year? I don't know. I mean, our health system, as many, had our similar policies that made it mandatory, and we always have, because we don't want to give flu to a patient who comes to see us. So I don't know in the general community whether there was higher uptake of the influenza vaccine or not.
Angela at K4 wanted to ask about the governor's new school policy. Do we know anything about that? Or?
Well, so the governor announced this week that in school districts that had mask policies, that if a student was exposed to COVID, they did not have to quarantine. In other words, they could still come to school. And he based it in part on some research that was done out of North Carolina, a large study that showed that schools didn't appear to be one of the principal places that COVID was being transmitted. But as the authors of that story now have subsequently pointed out, North Carolina had strict mask policies. They had strict policies on physical distancing or social distancing, and things like hand hygiene and other things. So the question is, will we be able to see the same thing in Oklahoma classrooms? Can we maintain mask policy? So that was part of the governor's point, that if you're wearing masks, you do reduce the transmission of the virus. The question is, how well will kids do that? And does that vary by age group? Can kids keep those masks on consistently in the classroom? Do Oklahoma classrooms have the ability to maintain social distancing, which is quite difficult in most K through 12 schools? So I understand kind of the concepts that they're pushing for, but as highlighted, it's not consistent with the Centers for Disease Control policy on cumulative exposure of more than 15 minutes within 6 feet of somebody, whether you're wearing a mask or not. The CDC still recommends quarantine.
And she also asked if you had heard about vaccine scams. She didn't give any details, so I'm not sure what she means. But.
Yeah, I've not heard of any particular vaccine scams. There are lots of myths and rumors and false information about the vaccines that are circulating. I haven't heard any particular stories about vaccine scams. I'm not going to be surprised.
Yeah. Okay, Mason at KJRH in Tulsa. Could you ask Dr. Bratzler about that COVID, the governor's office has said that COVID hospitalizations have remained pretty flat over the past 2 months. So,
well, I'd have to look back at the data. Last week we definitely hit, last week or so we hit the peak when we were well over 1,900 cases in the hospital, and that has come down a bit, and I hope that trend continues. Again, I've highlighted before, hospitalizations are very dependent on the new case counts. If we start confirming more cases of COVID-19 in our state, we'll see hospitalizations go back up.
Do we think that going back to, or taking away the nightly curfew of bars for 11 p.m. is going to have likely worsen the COVID situation?
I think I've been pretty clear about this in the past. I think transmission happens in bars regardless of the time of day. Whether bars have more patrons in them after 11 p.m., that could increase the risk, but let's face it, when you're at a bar, you don't have a mask on if you're drinking. Typically, crowds are there to socialize, often loudly, and that increases risk of transmission of the virus. So again, it can happen. It doesn't matter whether it's 7 o'clock in the evening or midnight. The transmission of the virus can occur in the setting of a bar or a restaurant or any place else where people take their mask off. That's just how we know the virus is transmitted from one person to another. So I don't know that it'll have a big impact.
Okay. Are there any mitigation efforts that you would like to see imposed to get a better grasp on the virus?
Well, I think we've talked about, so the question is, are there other mitigation strategies that we need to work on right now? I think all of us know how the virus is transmitted. It's person to person. Many of the people who are diagnosed with COVID now report a household contact. So we know that lots of people who get COVID-19 today get it from a household contact, but that household contact often got it in a workplace, in a restaurant, out somewhere in the community, in some social event, in some family event where you had people brought together indoors without a mask. It has to start somewhere. So So again, the mitigation strategies that we've talked about, de-densifying, fewer people, avoid indoor crowds with people. I still recommend that people patronize restaurants by getting carry-out at this point. Just don't go to places where large numbers of people are indoors and not wearing a mask, because that's where the virus gets transmitted.
I just had this one come in, and the CDC just announced that UK COVID variant could become the predominant strain in the US by March. Are we ready for that?
Well, so it's a great question. So the question is about CDC highlighting that the variant strain of COVID-19 virus may become the predominant virus in the United States by March. I think it's very likely. We've seen that happen before, and I think it's already here. We already know it's in multiple states. It's likely in Oklahoma already. And when you have one virus that is more transmissible, more contagious than another, yes, it will often take over the other strains that are circulating. So I think that may be part of the reason we've seen such a large number of cases here in the late winter, in late December, early January, is that we may well have the variant strain in Oklahoma that's spreading fairly rapidly.
And I think I read that they were saying that the vaccines are effective.
Yeah, the good news is so far all the evidence is that the current vaccines that are on the market that are being distributed right now actually do prevent infection, at least symptomatic infection with these new variant strains.
All right, that's all the questions. Anything you want to add?